Hello, everyone. It's Dr. Anna Cabeca here with another episode of Couch Talk. So this is where we have intimate, shameless, guiltless conversations to help you achieve your optimal health. So as you know, I am a board-certified obstetrician and gynecologist, board-certified in anti-aging, regenerative medicine, and expert in women's sexual health, as well as hormone balancing and using bioidentical hormones, empowering the body to restore itself. I'm the creator of Mighty Maca Greens, a health drink made up over 42 superfoods from around the world, as well as the online educational programs, womensrestorativehealth.com and sexualcpr.com. Today on Couch Talk, I am thrilled to introduce to you Jessica Drummond, who I have been watching her work and rise and her mission in life, really just looking at what she's doing to promote women's health in a very sensitive area that is difficult to address and challenging in general to treat. Not to mention difficult to talk about, and a very sensitive issue as well. So today we're going to talk about pelvic health, pelvic pain, and fertility, empowering our fertility, as well as preparing for pregnancy and what that entails. So Jessica Drummond, who I'm going to introduce to you today, is a founder and CEO of the Integrative Women's Health Institute. She is a passionate woman, and she is caring for and empowering women who struggle with pelvic health conditions. She's equally passionate about educating and supporting clinicians in confidently and safely using integrative tools to transform women's and pelvic health care, which is, again, it's like I wish she lived in my area and trained people in my area, and I will send them to her because it is so difficult to get a pelvic trained physical therapist, someone who is comfortable in treating pelvic pain problems, and also that women would feel comfortable seeking help from. So this is what she's doing, what her mission is, and what she's empowering. So I'm really excited that she is here with us today to give us some insight into what you can do, as also maybe where if you're a client with pelvic pain, you can then share this call with your healthcare providers. And this is a big gift to them as well, because when we're looking for answers to help our patients, we need to know reliable sources to go to. And she is setting the gold standard. So she's had over a decade of experience as a pelvic floor physical therapist, and she's owned her own women's health clinical nutrition and coaching practice, which has given her a unique perspective working one-on-one in clients and also working with, the client's physicians. So that's been key to give her insight and really how to help restore pelvic health and manage pain. She has been educated at the University of Virginia and also my alma mater, Emory University. She has also studied at the Institute of Integrative Nutrition and Duke Integrative Medicine. She's currently a doctoral student in clinical nutrition at Maryland University of Integrative Health. So Jessica, it's really a thrill to have you here with us today. I'm so excited. Thank you so much for being here with us.
Thank you so much, Anna. It's my pleasure. I'm honored to be here.
Well, Jessica, tell us how you got started to subspecialize or specialize in women's pelvic health.
Well, I started my career in physical therapy, as many of us do, in sports medicine, orthopedics. And one of my early patients, I was working with her with a shoulder injury. She had had breast cancer surgery, and we were looking to get her mobility back in her shoulder. And I realized that there are women's health issues that really at that time, this was probably in 1999, were not being addressed at all. We were rarely seeing patients like this. And so I started getting additional training in helping women who are pregnant and struggling with orthopedic issues like back pain, neck pain from breastfeeding, wrist issues, all kinds of postural problems resulting from pregnancy and breastfeeding. And, eventually I became trained in really deep therapies of the pelvic floor, which, at the time, again, it was very rare. It's still quite rare to have a really skilled physical therapist who works with the muscles of the pelvic floor, because while, if you can think of it this way, a lot of our patients that have chronic migraines have issues of neck, musculoskeletal problems or upper back musculoskeletal problems. So women who have pelvic pain, which can be just as debilitating, or if not worse than chronic migraines, their issues can begin with musculoskeletal problems of the pelvic floor, of the pelvic joints, of the hips, of the lower back, the deep abdominal muscles. And so I became trained in working with those muscles and helping women to have more understanding of how their pelvic anatomy worked and how much voluntary control they had over their pelvic muscles. Issues of continence is a big problem, around pregnancy, but also in some sports, 80% of female athletes have stress urinary incontinence before they even ever have any children. So this can be a whole lifespan issue. It's not necessarily just a menopause or after baby kind of issue. But really my love was for patients who are struggling with chronic pelvic pain, because it's so life disrupting. There's a lot of shame around it, difficulty with relationships and, their sexual identity. And so when I actually physically had my own health issues after the birth of my first daughter, so around 2004 to 2006, I realized that some of the things I did nutritionally to get my hormones back in balance after the birth of my daughter were effective with some of the patients that I was struggling with we were hitting roadblocks. They were getting better in terms of their musculoskeletal health, but they might still have pain at certain times in the month, or certain foods would flare them up, and we didn't really know what they were. So I started investigating that, and that's how I began to bring this approach, a sort of more holistic functional medicine approach, into pelvic floor physical therapy. I wanted my colleagues to understand this as well.
Oh, that's excellent, because you made so many really good points. First of all, that the pelvic floor issues span a lifetime, right? Yeah. And they can come and they can go. But also what we see is, how our nutrition, how our microbiome affects these pelvic floor issues span a lifetime. And as a gynecologist too, getting these skills into our clinical hands, because we're doing pelvic exams every day. We're seeing patients come in with recurrent vaginal infections, issues with incontinence, prolapse, pelvic pain and pressure, aseptic vaginitis, which was like, there's no definition, there's nothing to tell us what aseptic vaginitis is. And for me, that's inflammatory bowel disease of the vagina. We need a name for it. Mm-hmm. And until we remove the food sensitivities, do we actually heal? Until we restore the GI tract, do we heal? So as a physical therapist, dealing with these things and relating it to the pelvic floor, adding nutrition and restorative medicine in is huge, let alone the pelvic physical therapy. And to make it real for clients, I want to give an example. When I was treating a client for a concierge clinic, and she traveled basically around the country to top pelvic floor specialists. And she finally had come across one who did actual pelvic floor, internal, so as muscle release. And so what, she came to me, and it was tragic, because she'd been struggling for years with this. And I'd learned that in osteopathic medical school, but, you have to like practice it and work with it. But it was able to show her and show her husband how to perform that release so that she didn't suffer the pelvic pain, because her life was so restricted. I mean, she had difficulty standing or walking for long periods or sitting for long periods. It was constant discomfort, and that she'd been dealing with for her lifetime, essentially. And so it's really critical to know that no matter where you're at or how long you've had this physical health problem, that there's treatment, there's an answer, there's something we can do about it. The other thing, Jessica, like you, I mean, when I delivered my first child, I was in residency, and my oldest was born in 1996, and she was a big baby. They asked me, do I want a episiotomy? And I was like, no, I've been working on stretching the pelvic floor and all my, stuff that I was trying to do and conditioning the pelvic floor. And so we didn't do an episiotomy, but I had an anterior tear.
Mm.
And I learned very quickly that's the last thing. Always apply rectal tears, downward tears. We don't want any tears, but if we do have them, downward, not upward. That took years to heal. And you can think, okay, there's nothing there's nothing you can do about it, but there is. And we need to work on healing that, and we can get complete restoration, because it cause pelvic pain, difficulty with intercourse, painful intercourse, etc. And we want to restore from that. And then we go into the menopause, and then we struggle with vaginal dryness, discharge, weakening of the tissue, thinning of the tissue, discharge after sex, or irritation and bleeding, and incontinence, and those issues. And we have to know that we can restore that as well, and we can restore it quickly. The vagina, when I lecture on vaginal health, I always say, it is essential for life, and we can tell a lot about a person from the vagina.
Excellent. Absolutely. We can. Yeah. And I think, the important message that I think you brought up is it really is never too late. I mean, I worked with women who were struggling with chronic pelvic pain for 7, 10, 15 years. And it's challenging because there are so many aspects to pain. There is the brain's interpretation of pain. There is centralized pain in some women. There's organ crosstalk. So kind of like you talked about IBS of the vagina, a lot of times there's just plain IBS that's talking to the endometriosis, or the, ovarian cysts, or the fibroids, or, the pelvic floor. Constipation is a problem, long-term straining. So, and there are these very local issues which come up, sort of like your post-birth story. The tissues of the pelvic floor, and specialized physical therapists are so good at this, of figuring out, where are maybe some restrictions around the soft tissue around the urethra or the clitoris, or, local pubococcygeus, which is the muscle that's one of the muscles is kind of like a little hammock where your organs are supposed to be supported in the pelvis, and not always. We deal with prolapse. So I know it can be a big struggle, because a lot of times, especially after birth, women are told, oh, this is fine. It'll get better on its own. I know sex hurts. Just have a glass of wine and deal with it. It's not true. It's not normal for sex to hurt. It's not normal for your period cramps to be so intense that you can't go to work or school. And there are a lot of things that can be done, but you do need someone who's very skilled. I just came back from San Diego, the International Pelvic Pain Society meeting. And, we're looking at parts of the brain that light up with pain. We're looking at inflammatory mediators with bladder issues and endometriosis and vulvodynia and other pelvic pain conditions. And we're looking at really local musculoskeletal issues. And all of these often come into play with women who've been dealing with this, even if it's fairly acute, but certainly if they've been dealing with it for years.
So true. And Jessica, we're going to give our audience some practical tips on dealing with pelvic pain, as well as fertility, and, optimizing our fertility, especially if we've been struggling with infertility, as well as preparing for pregnancy. But before we do, I want you also to tell people, I know we're going to have a link on my website for a bonus gift that you're giving on how to confidently and effectively add preconception and perinatal wellness services to your practice. So we're giving that as a gift, so our listeners their clinicians, take it and run with it, or send it to their clinician, listen to it themselves, correct? But
Yes.
Tell people where they can find your website, and where they can find experts in pelvic health.
Absolutely.
Outside of their gynecologist.
Yes, absolutely. So my website is integrativewomenshealthinstitute.com. So you can always connect with me there if you can't find someone. But other great places to look are the section on women's health of the American Physical Therapy Association has a directory of clinicians. There is also another training school for physical therapists, pelvic floor specialists called the Herman and Wallace Institute, and they have a directory of some clinicians who've been trained by them. Another thing you can do is literally go on Twitter and ask for someone in your area and use the hashtag pelvic mafia. which is crazy, but there's some really skilled clinicians who follow that hashtag. And they're very well connected to physicians and surgeons and specialists of all kinds, of psychologists, nutritionists. So Pelvic Mafia on Twitter. And I would say the other thing is the International Pelvic Pain Society is a community of multidisciplinary clinicians of all kinds from all over the world. And so connecting with clinicians that are members of that organization or who have spoken at their conferences is another good option.
Excellent. Okay, great. So integrative health.
Integrative Women's Health Institute.com.
Integrative Women's Health Institute.com. Plus, I know you're on Facebook.
Yes. Mm-hmm. We have a Facebook page, Integrative Women's Health, as well.
Okay, perfect. Good. So that's another place for people to go and see as well. And then hashtag Pelvic Mafia and get some other resources too. Excellent. Yes. Thank you. Now let's talk about when you're addressing someone with that pelvic pain, whether it's from endometriosis or they're having dyspareunia, painful sex, or if they're just having chronic pelvic pain issues. How would you start, address, and what techniques would you use or recommend?
Well, I don't currently do hands-on pelvic floor physical therapy, but having had like 10 years in the field, I know how that would begin. So first, you definitely would look locally, and I often collaborate with pelvic floor physical therapists who look at the muscle tissue. Are there muscle tension issues? Is there what we call pelvic congestion, where you've got essentially a lack of lymph flow in the pelvis? Is the woman connected to her pelvic floor enough? Does she understand that she has voluntary control to contract and relax, more importantly, because doing things like Kegels over and over is not going to be helpful, but learning to let go of those muscles. And sometimes manual therapy techniques, which essentially is massage to the pelvic floor internally and externally, looking at the hip function, any pain in the hip, in the back, any referred pain down the legs or in the abdomen. Sometimes there are surgical scars that we deal with post C-section or post, say, sewing up an episiotomy or other kinds of pelvic surgery. So that's the physical therapy kind of lens. And then what I do now is more from a nutrition, functional medicine perspective is I look at starting really with digestion. So everything really often does come back to the gut, right? And so is a woman chewing her food adequately? Is she eating under stress or slowly? What is her relationship like with her chronic pain condition? Does she have support and help for that? Or is her family starting to feel really resentful that she's been in pain and, she's frustrated? Does she have some emotional challenges that we walk through? And then we look at, from the gut, we look at, are there food sensitivities? And I've actually created what we call the pelvic pain elimination diet, because in the literature, there's actually a wide variety of food sensitivities that are associated with pelvic pain conditions. And in the case studies that have been published, they're very different for each woman. It's not like everyone needs to be off gluten or everyone needs to be off dairy. It's highly variable. The most common ones are dairy, gluten, soy, and sugar. Or any form of sugar, which unfortunately includes caffeine and alcohol. So that kind of taking away the foods that are irritating the digestive system is the first step. And then optimizing the function of both the digestive system and the detoxification systems, because in a lot of conditions, certainly things like endometriosis and fibroids, where there's this overgrowth challenge, we have what's called estrogen dominance being a problem. And often that's because the liver is not adequately processing estrogen. So supporting with leafy greens, green drinks, that kind of thing, certain kinds of B vitamins, depending on the genetic makeup of individual women. I think it's important to understand that minimizing the toxic load is the first step. So there are lots of things that women can do to reduce toxins, and this is really important prenatally as well. So even if you don't have pain of any kind, but you want to get healthy prior to pregnancy, you want to reduce, the kinds of environmental chemicals you're putting on your skin or using in your shampoos or you're using to clean your house. because all of that, the liver has a strong capacity to deal with it, but only to a certain extent. And we don't want to overload the liver. We want to support it and minimize the work it has to do.
So what are some of the most common reasons that you see that women struggle with pelvic pain and infertility have? What are the most common reasons?
I would say the number one for both would be endometriosis. So, and endometriosis is challenging. The gold standard now of treatment is to have excision surgery. If, it can only be diagnosed by laparoscopy. And then I would look for just an absolutely brilliantly skilled surgeon to find and excise the endometriosis. But after that, the story doesn't end. We want to then use all of these nutrition tools and lifestyle tools and pelvic floor musculoskeletal treatment to really reduce the inflammation that goes along with endometriosis. Support hormone levels. We want to really increase progesterone levels, which can be done with, food in many cases. Definitely with endometriosis, we have issues with gluten sensitivity in a lot of cases. So it's a very multidisciplinary approach. The other thing that I see commonly, two other things that are the most common in terms of infertility and pelvic pain are PCOS. So women who have PCOS, polycystic ovarian syndrome, have painful cysts. They often have pelvic pain and sexual pain, especially those women that have the highest levels of testosterone and the biggest challenges with insulin resistance. So we want to work on hormone balance, reducing sugar absolutely in the diet. That can be managed much better with a more conservative approach. Endometriosis is also potentially can be managed with a conservative approach, but in the most severe cases, it often does require surgery. And then the other one that's most common, and I actually personally struggled with this when I was dealing with my own hormonal issue between my two girls. So my two kids are 7 years apart, and I simply had a pretty bad case of adrenal fatigue. And when your body is under stress, even if you don't really recognize it, it depletes your sex hormones. And this is where the mighty maca, I think, is the best thing we can pull in here, because maca works really well for low estrogen and low sex hormones. If you were dragging and you're 32 years old, like I was, you need to restore your relationship with stress. You need to change how you're eating. And things like maca and other herbs, which really support I guess, we want to be like overly nourished. We want to be just really nourishing these women in all possible ways with physical, connection, emotional connection, and foods that are really high in nutrition and support hormone balance. Because I struggled for about 3.5 years with secondary fertility with no structural issues, no kind of quote unquote hormonal issues on any standard testing. But my adrenal fatigue, my cortisol numbers were terrible.
What were some things that you integrated to help you overcome this?
To overcome my infertility?
Yeah.
Really, it came down to nutrition. I almost completely eliminated sugar for several years, ate a lot more protein, a lot more healthy fats. At that time, so this is probably like 2003 to 2010, kind of in this range, and earlier, the dogma was a low-fat diet is healthy for health, for heart health. And my dad had a heart attack in his 50s. He's still alive. He's fine. But that was my family history. And so I had been on a low-fat diet since I was a teenager, which is the worst thing you can do for a female teenager, childbearing years, So really enhancing healthy fats. Hormones are built with fat. And so thus babies are built with fat, right? And so I changed my diet quite significantly. I started going to sleep a lot more, changed my relationship with stress, things that, we had moved a lot, things that bothered me. I started to look at how I was responding. And it was 100% natural approach, some herbal supplements like maca. And once my body was physically healthy, it took me like 2 months to get pregnant.
That's so true. I struggled also with secondary infertility and was told at 39 I was in complete premature menopause. I had ovarian failure, and the only way I could conceive another child would be through egg donation. So, my journey took me around the world to find answers, but part of that was exactly getting hormonally balanced, getting my body back in touch with nature and alkaline, right? Just move out the acid, eliminate the sugar, and do a lot of those stress management techniques. And, I put that into my program as the ABCs of sexual CPR. It's like, how do we revive ourselves, basically? And that's part of it, but so true. So, I have many clients who are in their 40s trying to conceive. And for my practice, a few of the things that we start with essentially is detoxification, right? Let's detox, enable your body to optimize the hormones that it's producing naturally, and decrease any endocrine disruptors, et cetera. So we go through a medical foods and mod-fat elimination diet detox. And then 2 is hormonal balance, right? We want to empower the hormones. Progesterone's huge for my infertility clients. And in the rare case I have someone with progesterone sensitivity, we'll go to pregnenolone, we'll support DHEA, certainly addressing those issues of adrenal fatigue. So many clients have come to me with infertility and have had IVF and have failed, and they never had an adrenal workup. They never had a toxicity workup. And it's hard for me to hear that because, I know they've invested not just money, but their heart. And every negative pregnancy test is a pregnancy loss. And it's grieving, and we don't acknowledge it like we should. And we really do need to, because it affects our soul. And so coming to peace with that and being able to attempt again, these are strong people, right? Very strong people. So we really need to do this empowerment. And like you said, the nutritional aspects, like what we would, when we're pregnant, we have this heightened awareness of what we want to feed and nourish ourselves, as well as with our babies. So in the pre-pregnancy stages, really empowering that. And then key supplements, omega-3s, DHA, right? Carnitine. Carnitine, I would use very high potent, very clean carnitine, and that's essential. Methylated folate, small doses. The prescription prenatals as an obstetrician were always subpar to what I used. And I'll tell our listeners, the Metagenics prenatal packs, Zymogen prenatal packs, Dr. Ben Lynch's prenatal packs. I mean, those are what we want to get. Your prescription prenatal is just not going to do it.
Well, and especially for women who've had pelvic health issues, because, we know now that when women are just taking high doses of folic acid, the synthetic form of folate, they actually have an increased risk of colon cancer. So if they've already had colon problems and IBS or IBD or, struggling with constipation, we don't want to worsen that risk with high dose folic acid. We definitely want to use methylated folate supplement. And those professional brands are much better. And I think, I 100% agree with you. And one of the things I do from a coaching perspective is really have, women and their partners need to reconnect emotionally after going through infertility treatment. And a lot of times, especially when I was working in hands-on pelvic floor PT, when you've lost your ability to have sex in a spontaneous, relaxed, healthy, happy, non-painful way for years, the relationships suffer. And so a lot of times the partners would come in and I would just really help them to build bridges between each other, both physically and emotionally, because partners really do care and they want to understand a woman's anatomy. But I've had women who, had babies, multiple babies, and still didn't have a very good understanding of their pelvic floor anatomy. And so it's hard for them to connect and explain to their partners like what positions feel comfortable. And it's hard to relax during sex when you don't know if it's going to be painful in any given moment. So really having some deep communication support between couples, both for the emotional challenges of multiple infertility, but also long-term sexual pain, rebuilding that connection is essential.
That's so crucial. One of the things I tell women is, because it's often subconscious, like, I just don't want to have sex anymore. I'm like, well, if you were playing baseball and every time you got up to bat and you got hit by the ball, would you want to play baseball? I mean, seriously, it's negative feedback. You're like, I don't know why I don't like that sport. But pretty much if you get hit by the ball every time, you kind of know. But with sex, it's the same thing. If you're having pain, discomfort, irritation, it hurts. You're not present, that you're not enjoying. The reason is to build enjoyment, connection, restore that connection. God designed intimacy so that we restore our connection and we maintain our relationship for our lifetimes. And that's so crucial. And when we go into, especially after postpartum, it's one of those times, perimenopause, menopause, another one of those times, there's the potential to disconnect because we're uncomfortable, but we don't have the voice for it. We're not able to express ourselves, or we're not getting the help that we need. And so for clients, often I've used progesterone postpartum along the pelvic floor, hugely beneficial. Also in the menopause, perimenopause, one of the hormone creams I've created is the Pure Balance Progesterone Pregnenolone Combination Cream, which can be applied to the vulva. I'm coming out with the DHEA Combination Vulvar Cosmetic Cream, and that's amazing. And that is really helpful to restoring the muscular layers of the vulva and vaginal tissue as well. So excited about that. But your prescribers can write vaginal hormones for you, and through a compounding pharmacy, use vaginal hormones to strengthen the pelvic floor. Jessica, when I was doing pelvic sling procedures, I remember one day I did 6 pelvic sling procedures, and they're great, but all the consequences of pelvic slings is erosions, pain, etc. Thankfully, I didn't have those. But when I would see clients with this, I started using vaginal hormones, and that would restore the tissue. And also I started using vaginal hormones before I would operate. And then I didn't need to operate because the incontinence went away. So it is, whether you've had a sling, didn't have a sling, you have incontinence, you have vaginal dryness, let's get hormones right to the tissue where they belong versus taking high dose oral hormones to try to get there. Let's put it directly where it needs to be, and safe. And I will say odorless, tasteless. That's really important. Your compounder can do this. They can make vaginal tablets. They can do all these things. So I've worked with pharmacies to do that. And compounding pharmacies are expert at it. So I highly recommend getting in touch with your physician. Now, do you offer that instruction in your courses too to providers to understand what pelvic floor vaginal hormone therapy can, is that part of your programs too?
I don't really talk about that, although I'm starting to think you need to be a guest speaker on our program because as a nutritionist and as a physical therapist, we don't prescribe hormones. We collaborate with physicians to do that. So, and most of my training is designed for non-physician clinicians. But although actually we've had quite a number of physicians do the program because they need everything else. They know a lot of times more of the medication options, although they don't know that degree a lot of times. And I think that's important because absolutely right. We see the best results when we're collaborating as pelvic floor PTs, because if you're doing a lot of manual therapy work and the tissues are very fragile, it's painful. You have to be much gentler. You can't get as good results. Doing it in combination with local hormones is often essential. So we do need to add that piece for sure. But for the physicians that are doing pelvic exams, but not necessarily looking at the muscles, they kind of put the speculum in and move the muscles out of the way. There are a lot, of pieces of that are important. We need to understand what the muscular anatomy is. But I think going back to just the whole person approach, in the pelvis, it's a confluence of digestive system and reproductive system and bladder. And so we can't look at just one subspecialty in the pelvis because these organs all talk to each other. So as clinicians, we really have to be thinking, even if we are, physical therapists or obstetricians and we're looking right at the vulva and we're looking right at the vagina, we've got to think, well, are they having constipation? So they're straining every day. Well, that's of course going to make the the incontinence worse, or are they having a lot of bladder pain at night and they're not getting a lot of sleep and they've had chronic pain? Well, that's going to contribute to adrenal fatigue, which is going to knock the hormones out of balance. So it's really a whole person approach that we have to consider for women struggling with these issues.
That's so true. I mean, really, because you have to look at those aspects too in treating pelvic floor dysfunction or pelvic floor health. What about Kegel or pubic coccygeal muscle exercises? Prefer to use that term, or using the weighted balls in the vagina, or magnetic therapy for the pelvic floor, or TENS unit. So these are some instruments that we can use in the pelvic floor.
Yeah. So pelvic floor exercises, we've got Kegel. Dr. Kegel was the first one who thought of, essentially just contracting the muscles of the pelvic floor, trying to stop the flow of urine. That's how women understand that most basically. There are lots of different ways to do pelvic floor muscles. Sometimes it's an endurance problem. Sometimes it's how strong and fast can someone contract their pelvic floor. And these these exercises are most appropriate in women who have challenges maintaining continence, prolapse, postpartum. They're trying to regain the stability of all of the pelvic and lower abdominal muscles that have been overstretched. Or if, they had an injury, say to the spine, or a really heavy lifting, and they just lack strength and stability in the pelvic floor. There was a video about like a bunch of CrossFit athletes lifting really heavy weights and then peeing, and that was like a badge of honor. That's terrible because you're just blowing out your support. And, the biggest cause of death for women in their elder age is falling and having a hip fracture, which happens because they're getting up to go to the bathroom in the middle of the night, right? So all through our lives, we want to be really concentrating on strength of the pelvic floor, but those kinds of exercises are not appropriate for women that have pelvic pain, because often it's an issue of, generally the muscles are actually rather weak, but if you think of if you're walking around carrying 80 pounds in your arm, and you never straightened your arm, you don't have that full range of motion. Same thing with the muscles of the pelvic floor. You don't know how to relax. They can be weak, but very tight, very shortened. Mm. So, and then the other tools like TENS units are helpful for pain. Essentially, it's a connection. It kind of changes the pain input to the brain. So that helps with educating women about how much control they have over their brain's interpretation of pain. And we're learning a lot about this, that pain is such a biopsychosocial phenomenon. If you're afraid, your pain can be worsened. If you've had a history of pain, your pain can be worsened. There are memories of pain that can be worsened. I've even seen some recent data about memories going back generations that can be passed down in your DNA. So women can begin to shift their perspective of pain, and the brain is plastic, so we can kind of train pathways in the brain to reduce pain. But I don't want any women to hear when I say that we think the pain is all in your head. It's absolutely not. It's real pain, and it's being interpreted by your brain in a certain way. And it's nice that we have potentially a lever in your brain's interpretation of pain to help reduce it. But I 100% think that every woman who's struggling with pain has real pain. And then I actually have not personally used vaginal or magnet therapy in the pelvis. I just saw some of my colleagues were starting to wear, magnetized underwear to kind of test it out and see what they thought. I don't know of any studies about that on the top of my head. And then finally, I wouldn't actually, generally speaking, recommend walking around with pelvic floor weights inside your vagina. Number one, usually they're not very effective because you're going to just have them sitting in a pocket of space in your vagina. You're not going to be actively holding them there. And you wouldn't actually want to actively hold something in your vagina all day long, the same way as you wouldn't want to carry around a jug of milk in your arm all day long. The muscle isn't designed to just carry something all day long. It's designed to contract when it needs to relax when it needs to maintain continence. But we do use some kinds of wands and dilators and things like that to help stretch out the muscles of the pelvic floor in an appropriate way, using some vaginal weights as a feedback tool. When a woman, it's hard to tell, like, am I really contracting this muscle correctly? So if you're in the hands of a physical therapist and you have specific exercises with those tools, that can be very valuable, but you just don't want to walk around all day with vaginal weights, hanging out in your vagina.
Right. Good point. You need to be selective with those for sure. Now, Jessica, I want to hit just on, before we close, on recommendations for male and female fertility, nutrition wise, etc. What are your key recommendations to optimize fertility, female fertility and male infertility, especially if women have been on birth control pill for a long time? So let's talk about that, because we know that birth control pills can disrupt our feedback mechanisms within our body. Also, it's high amounts of estrogen and synthetic progestins, and it requires many of our micronutrients and macronutrients to metabolize these hormones, so we become magnesium deficient, zinc, etc. So there are some issues there with nutrient insufficiency with long-term birth control use, as well as estrogen dominance, etc. So you have a couple coming in. She's been on birth control pills for 7 or more years, and he has a low optimum sperm count.
So I think for men, the first place I would go is the gut. We do know that the gut microbiome is out of balance in men who have suboptimal sperm, I would say sperm quality and seminal fluid, and improving their lactobacillus. We don't know the specific strains yet, but lactobacillus is a kind of probiotic, and also foods that encourage butyrate production in the colon. So that's complicated, but basically it means you need to eat more green bananas, butter, coconut oil, green bananas and other resistant starches like cooked potatoes that are cooled, things like that, certain kinds of starches. So encouraging certain kinds of bacteria in the colon has a specific impact on two things for male fertility. One is seminal fluid and sperm quality. And then the second is this barrier called the blood-testes barrier. So we've got the blood-brain barrier. We've got all these barriers in the body that are supposed to keep certain things from being in other places. And interestingly, the blood-testes barrier is one of the tightest barriers in the body. So we want that to stay tight, and certain microbiome compositions lead to that more than others. So go back to the gut for your partner. And then for the women, yes, so she's been on birth control pills for many years. Several things are going on. Number one, sometimes sex hormone binding globulin can continue to be elevated, which is a protein.
I want to interrupt, Jessica, because I want women to also to hear this for men too, because it's important too, if men have a low sperm count, that we're looking at, again, that detox factor is really important. Part of that is healing the GI tract, but detoxing as well, because of all the endocrine disruptors can drive testosterone down and decrease sperm production. So we definitely want to do that. No alcohol, boxer shorts are great. Stay out of like really hot temperatures. But in general, that's key. The other, again, same thing, to improve sperm mitochondria, we work with adding zinc, arginine to improve nitric oxide synthetase, and as well as carnitine and methylated B vitamins, including methylfolate. So those are some, and healthy fats. Like you said, we want to get up that butyric acid. So those recommendations are key, and then knowing which starches and how to eat those starches, which is another lesson in and of itself. But I've got to figure that one out. But that's key, prebiotic, probiotic, and very important for healing the gut and the GI tract. So ladies, I want you to listen to that too. It's important for our guys that they understand this is really, really important. Those sperm are fragile. That's why you need billions to our one egg.
True. Yes. Yes, absolutely. And those micronutrients, the same challenge with women. We need men are exposed to so many estrogens in our environment. We really need to support the liver to be able to metabolize those. So, and then for women, number one, I would start actually with looking at her baseline hormone balance. Do a cortisol, diurnal cortisol saliva tests, see if she is struggling with any adrenal fatigue. And then if she's been on birth control pills for a long time, we need to restore nutrients. So the methylated B vitamins, she also needs to take those. That the detoxification of the birth control pill for years requires a lot of those, and she may be depleted. The other mineral that I think is so important, you mentioned magnesium and zinc, essential, also selenium. And there's some good data that if you take selenium prior to pregnancy and through pregnancy, and it's a small amount, I believe it's 200 micrograms, you can significantly reduce your risk for postpartum hypothyroidism. And that's important because that's one of the times when the thyroid really, shows up going haywire. Hashimoto's can be triggered, other causes of hypothyroidism. So we want to address that pre-conception, or at least prenatally would be good. So nutrient restoration, detoxification, which involves lowering the toxic load and supporting the liver with methylated vitamins, methylated B vitamins, cruciferous vegetables, lots of antioxidants, C, E, polyphenols, and also the proteins that you mentioned, the amino acids. So you can't complete detoxification without having high levels of carnitine and arginine and all of these other amino acids. So just doing like a juice fast is actually not the way to go, because you pull the toxins out, they're all hidden in fat, which is a little bit safer in the short term. And then you pull them all out with a juice fast. But if you're not eating any protein, you can't fully excrete them. So protein is,
right.
Yeah.
Is these intermediate particles we know are even more toxic than the original toxins. So the phase 2 liver detox support is so crucial, and you need to do that with protein. So I'm glad you made that point, because that's a crucial error. Certainly juice fasting can help heal the GI tract, decrease inflammation, but as far as the toxin removal, and remember, we want to protect our brains. So, so it's crucial that we eliminate those toxins safely, and we need protein to do that, proteins and healthy fats.
Yep.
So good. Well, okay. I wanted to thank you so much, Jessica, for being with us today. You're a wealth of information. I'm glad you're doing what you're doing in training providers and physical therapists, et cetera, to address holistically women's health and women's pelvic health. So for our listeners, integrativewomenshealthinstitute.com to find Jessica Drummond, as well as on Facebook, and follow us. Share this podcast. It's an iTunes podcast. Share this podcast or YouTube video with your providers, with your clinicians, or with someone you know that's been struggling with pelvic pain. And I thank you for listening. Jessica, some closing words?
I think it all goes back to what we talked about in the beginning, that despite the situation that you're in right now, even if it feels very hopeless, if you're really struggling, there are really skilled clinicians out there who are working hard on pelvic pain issues and fertility issues and want to support you. So never lose hope. You're also not only these clinicians, but you. Every woman has, a lot of resilience. And I think trusting in that and learning to tap into it, there's always hope.
That's so, so true. Women are tremendous at resilience and restoration. The body has tremendous healing capability. So Jessica, thank you so much for what you're doing. And thank you to all our listeners for being with us today. This is Dr. Anna Cabeca closing on Couch Talk. Thank you.